Testing. Is it working? Oh, yeah, it is. Okay. Good morning and welcome to Wichita State University's Weekly Briefing. I'm Tracy Freese, Director of Communication for Industry and Defense Programs. These briefings are held in an effort to keep the campus and public better informed about the occurrences at Wichita State. Wichita State University Administration and Student Health Services continue to closely monitor the evolving COVID-19 or coronavirus 2019 pandemic. The health and safety of our students, faculty, and staff is our highest priority. Camille Childers, Director of Student Health Services, is the pandemic team lead for Wichita State. Rick Buma is the Provost for Academic Affairs and the university's Chief Academic Officer. Childers and Muma are here today to talk about Wichita State's response to COVID-19.
Good morning. Responding to a public health emergency really requires a team effort. That's what the work of the WSU Pandemic Planning Team has been focusing on. The objective of the planning team is to, and has been, and will continue to be, the coordination of the campus response to this ongoing outbreak. Team members consist of student representatives, individuals from multiple campus divisions and departments. We have focused on developing a comprehensive response to address the health and safety of students, staff, faculty, and the campus community during this very challenging time. This approach includes working with our local and state public health partners, keeping the campus informed, responding to questions and concerns, and providing health information and resources. Strategic communication staff have done an exceptional job of keeping WSU's online COVID information current. Please take a time to review this information and check back frequently for updates. The links are on the screen. I would also like to express my appreciation for the work and responsiveness of the pandemic team members and all the people that work to support this process. This is truly a group effort. The pandemic planning team will continue to meet through virtual meetings to practice social distancing, and will continue to address issues as they arise regarding the COVID-19 outbreak. I'd like to share with you some information that came out yesterday from the Kansas Department of Health and Environment regarding the they update their information every day, and so this is the one from yesterday regarding the outbreak for COVID-19. As of yesterday, there were 21 confirmed cases in Kansas. 11 of those are up in Johnson County. So what that means, according to the State Health Department, is that Johnson County is now considered to have community transmission. That's a new factor for Kansas. There are currently no active cases in Sedgwick County or in Wichita. That's an important fact to remember. It's also important to note that KDHE has updated their quarantine guidelines for those people returning from locations overseas and within the U.S. So I'm going to read that information so people are aware of this. They are now mandating a 14-day home quarantine for Kansas who have traveled to an area where there's known widespread community transmission. That currently includes California, New York, Washington State, and as of yesterday, Florida. So spring break people coming back from Florida, that applies to you. What that means is if you returned on or after March 15th, you must do the 14-day home, stay at home basically, quarantine. So I'll go into that a little bit more in detail. It also applies to anybody that has visited Summit, Eagle, Pitkin, and Gunnison counties in Colorado. Same date, if you came back on or after March 15th, you're required to do the 14-day home quarantine. It applies to anybody that traveled on a cruise or river ship, the same date, March 15th. Anybody that traveled internationally and arrived back in Kansas on or after March 15th. You still have individuals that may have received notification of public health officials that they are close contact, every confirmed case, the quarantine also applies to them. So a little bit new information there. They are now mandating this quarantine, so it's really not optional. There is no need any longer for people that are going through quarantine to contact the KDHE. So that has been removed as well. So what does home quarantine look like? What does that mean? Basically, those who are under home quarantine should not attend school, work, or any other setting where they would not be able to maintain a 6 feet distance from others. Person under quarantine, if they develop symptoms of COVID, which include difficulty breathing, fever, or cough, they should contact their healthcare provider. Don't just show up. They want you to call first, because to protect our healthcare providers, we need to be aware of who may have symptoms of COVID. So they will want to greet you, have you put a mask on. They want to wear protective personal equipment. We need to protect the healthcare community as well. So there was been receiving a lot of questions regarding testing. As of yesterday, according to KDHE, testing is done based on symptoms. They currently do not have the ability or the volume to test people that are asymptomatic. There's also the thought process there that if currently I went and got tested, I don't have symptoms today, but I got tested and I'm negative, that doesn't mean that I'm negative next week when I may be exposed. So testing asymptomatic people right now is not a good option. So if you're not experiencing symptoms or you've not had a risk factor, as I detailed previously, right now there is no testing available for asymptomatic people. So what can you do? It comes back to the things we've kind of been saying all along. Prevention involves making sure that if you need to go into a 14-day quarantine, if you meet that threshold, that you follow those guidelines. It also means to reduce your risk, that you continue practicing healthy activities such as covering your cough, sneezes, things like that. Washing your hands. We say this a lot, but I can't say it enough. Make sure you're washing your hands with soap and water. That's the best way. If you need to use hand sanitizers in between using soap and water, if you can't get to a sink right away, that's a good option. Make sure you're cleaning your areas appropriately. Make sure that if you are sick, that you're calling your doctor ahead of time. And you also want to make sure that you're trying to avoid touching your eyes, nose, and mouth. So keep your hands away from your face as much as possible. KDHE has some great information on their website. Also, all of those links are from our website here. If you've not read that information, please do so. There is obviously a lot changing in this situation, so it's important that you go back and check for updates. Just remember the fact that public health is a group activity. This is not one person alone doing something. It's all of us helping each other. So thank you very much.
Good morning. I'm Rick Muma, Provost here at Wichita State. Let me start by first acknowledging the unprecedented nature of this situation. Coronavirus, or COVID-19, as we like to say. It's unlike anything we as a community or as a university have had to deal with. You'd heard from a variety of sources that the situation is fluid. It is. Sometimes it changes by the day, sometimes by the hour, sometimes by the minute. As the university has had to adapt to these changes, please be assured that we do so in the best interest of the university and our students and our faculty and staff, and keeping in mind that we're also concerned about the health, safety, and well-being of our campus community. As you know, the university has taken a multitude of steps in response to coronavirus. You can find full details on our website and the FAQs about our response. You can go to wichita.edu and you'll see a link to the COVID-19 website. I encourage you to do that frequently because this is where most of the information is updated and current. Well, it's where all of our information is updated and current. While each of these steps has an impact on our university community today, I want to talk about some of our biggest changes and some of our challenges. So let's first talk about classes. All in-person classes are moving to an online and remote format. This transition is happening now and will begin the week of March 30th, the week after spring break. Our spring break is next week and will continue for the rest of the semester. In my role as a Chief Academic Officer, I'm also a PA and a public health practitioner. Part of my job is to ensure the delivery of our curriculum. We are adjusting to a new reality, at least for the next 7 weeks, and have taken a number of steps to make this transition as smooth as possible. So first of all, we've been providing our faculty training in online and remote teaching modalities. We are instructing faculty to balance maintaining quality of their teaching and also allow students to learn and be evaluated a little differently. In other words, we're encouraging our faculty to be creative. Some of the best solutions, teachings, compositions, performances over time have come out of situations like this. We're also setting up, or we have set up a working remote web page for faculty and staff. It's linked to our COVID-19 website with tools to help navigate through this transition. We're also purchasing Chromebooks for students, laptops for faculty and staff, and cellular hotspots for students, faculty, and staff who need devices and wireless connections to do this work if they don't have access to it. Please understand we have limited supply, so we are only providing the equipment to those individuals who don't have other options. I'm having the deans regularly communicate with students so they remain connected to their major area of study. We want to make sure that the students continue to receive premier instruction, and most importantly, that they are able to graduate in a timely manner. WSU's One Stop is also messaging students about key reminder dates. For example, summer and fall registration starts the first week of April. We want to make sure folks know that and keep on track and don't miss these deadlines. Additionally, the One Stop is available 24/7 every day of the week, and that number is 1-855-978-1787. That's 1-855-978-1787. We have individuals who are answering calls, entering in live chats with students to answer any of their questions. This is a service that we've had for the last 3 or 4 years, and it's obviously come in handy now that we are having limited operations on campus. And Student Affairs is continuing to make connections with students, now virtually, making sure that they're connecting with students, providing counseling services, and so forth. In terms of commitment, you all know that we have postponed our in-person commitment for the time being. That's not a decision that we take lightly. We know that's disappointing to many individuals, and we are exploring a variety of options, including providing a virtual ceremony, scheduling a ceremony in summer or early fall, or expanding our December graduation to include spring graduates. While no decision has been made yet, what is certain that we will honor our outstanding graduates and their accomplishments. And as soon as we know that, we'll communicate that more broadly to the campus. In terms of housing and residence life, for the past couple of weeks, we have been encouraging all students who are living on campus to relocate if possible. In an effort to support public health efforts by Sedgwick County and the state of Kansas, we will officially begin limiting on-campus housing operations starting at 5 p.m. on Sunday, March 22nd. Please know that we understand this is a burden on students and their families. However, we are allowing individuals who have no other options to stay on campus, and currently there's about 150 students who are in that situation. I encourage students to reach out to Housing and Residential Life if you have further questions or concerns about that. In terms of computer access and university facilities, we continue to think through how best to support our students who don't have reliable internet connections or who have need for specific computer software. More details will be coming out today, making that more clear, and that information can be found on the website that I mentioned earlier that's linked to wichita.edu. As long as we are open for physical presence, access to Oblau Library will be limited to students and employees. So those who have a valid Shocker ID will need to swipe in to gain access to that facility. We also have limited access in the College of Engineering for computer access. So finally, WSU continues to work with local and state public health authorities to ensure the safety and well-being of our community. This is a complex, changing, and fluid situation that is constantly changing. We greatly appreciate your patience, cooperation, understanding as we come together as a campus community to deal with this unprecedented situation. Be happy to answer any questions. Yes. Can you talk a little bit louder? We're not really making any public announcements. We don't have anybody who is tested positive at the university. So the question was, do we know of anybody in the campus community who's been tested, or is anybody who's positive for coronavirus? Yes.
And then do you have like a highlight of what all students are being refunded for? So, we know housing and possibly parking, but students are wondering about, the student activity fee and the wellness fee.
Yes, so we currently haven't made any decisions about tuition or fees at this particular time. That's ongoing conversations that we're having. We had some discussion about it this morning, but we haven't made any decisions on that. In terms of tuition, I just will say, we are offering a different method of teaching. So at this particular time, tuition definitely would not be something that we'd be considering refunding, because we're still offering the product, classes, although in a different format.
And then do you know a timeline of those refunds? I know yesterday, for example, they said they were trying to follow the board policy.
Yeah, we're still waiting on some guidance from the Kansas Board of Regents, so stay tuned on that. We don't really know. So the question was, was that what's the timeline on any of these refunds? I think you're the only one here that has questions, so feel free.
Last question is, I know K-State yesterday announced that they had plans to pay their employees and staff who are affected by basically like the campus shutdowns and working from there being students and everything on campus. Is there any sort of plan for that, especially for student employees as well?
Yeah, so you and others will receive further information about that, but right now there's no plans to disrupt any pay for our full-time employees, the main employment sector of the university. We're still having some conversations about students and how that would be affected, and again, we had a meeting this morning about it, so stay tuned for further information about that. Anything else? Okay, thank you.
The weekly briefing series will end today, March 19th. The briefings began in the fall of 2018 in an effort to keep the campus and public better informed about the progress occurring at Wichita State. The university will continue to keep the campus and public informed through different forms of communication, in addition to news conferences as appropriate. On the first Tuesday of each month, the First Tuesday newsletter will be distributed to Wichita State faculty, staff, and students. Also published on First Tuesdays will be the President's Connection with a target audience of alumni and community. If you are not an alumnus and want to subscribe, email president@wichita.edu. The Wichita State Research Newsletter will publish every other month. To subscribe to the research newsletter, email research@wichita.edu. President Golden is also active on social media. Follow Dr. Golden on Twitter and Facebook @PresidentWSU. Follow Wichita State University on Twitter, Facebook, and Instagram, and those are all great places to ask questions during this time. In closing, I'd like to remind you of Wichita State's vision and mission. Our vision to be internationally recognized as the model for applied learning and research, and our mission to be an essential educational, cultural, and economic driver for Kansas and the greater public good. Thank you for your attention. Please stay tuned to wichita.edu and follow Wichita State on social media for further updates.